Welcome to Foundation of Orthopedic Trauma. As an EMT, you are not here to read x-rays or perform surgery. Your job is simple but critical. Identify live threats, stabilize the injury, and preserve function.
Open and clear. So ideally we make extra space
There are three main ways the musculoskeletal system fails. We categorize them as fractures, which is a break in the continuity of bone. It can be closed, meaning the skin is intact, or open, a bone end has torn through the skin. Open fractures are high risk for infections and serious bleeding. For dislocations, the bone ends are no longer in contact at the joint. These are incredibly painful and can pinch nerves or vessels. Sprains and strains. Sprains involve ligaments, being the ligaments connect bone to bone. Strains involve tendons, which connect muscle to bone. In the field, we treat these exactly like fractures because we can't rule out a break without an x-ray. When you arrive on scene, look for obvious decal BLS TIC. Remember, deformities, contusions, abrasions, punctures, burns, lacerations, swelling, tenderness, instability, and crepitus. But to truly assess the limb's health, you must memorize the 6 P's. Pain. Is it point, tender, or widespread? Pallor. Is the skin pale or mottled? Paresthesia. Can they feel you touch their toes or fingers? Pulselessness. Is this a late surgical emergency? Paralysis. Can they move the extremity? Pressure. Does the limb feel tense or tight? Always check CMS, circulatory, motor, and sensory, before and after any movement or splinting. Our goal is immobilization. This prevents further damage to muscles, nerves, and blood vessels. Rule of splinting: you must immobilize the joint above and the joint below the injury site. The exception: if the injury is at a joint, immobilize the bone above and below. If the limb is severely deformed and pulses are absent, you may attempt to realign it with gentle manual traction. Only do this once, following your local protocol. If you meet resistance or the patient screams in agony, stop and splint in the position found. For life-threatening ortho trauma, most broken bones aren't kill shots, but 2 are. Pelvic fractures. The pelvis can hold several liters of blood. If the pelvis feels unstable, use a commercial pelvic binder or a bed sheet to close the book. Do not repeatedly rock the pelvis back and forth during your exam. The second is a femur fracture. A mid-shaft femur break can cause massive internal bleeding. This is your primary indication for a traction splint. In summary, when in doubt, splint it out. Control life-threatening bleeding first. Check CMS. Measure and apply your splint. Recheck CMS. Stable bones means a stable patient. Master your splinting skills in the lab so they are second nature in the streets.